Ever wonder how like one decision can snowball into like a global wake-up call?
Yeah.
We're about to take a deep dive into 10 real-world cases
Mm.
where policies, products, even simple oversights
Yeah.
had a huge GE impact on health and safety worldwide.
Yeah.
Buckle up, because some of these stories
Yeah.
might just make you rethink the everyday choices we all make.
I think what's so fascinating about these stories is how these seemingly isolated events
Yeah?
actually kind of reveal a bigger picture. They expose the interconnectedness of our world
Right.
and how actions in one place can have these like ripple effects that cross borders and
Yeah.
even across generations.
Okay, let's unpack this, starting with a story you might have heard of.
Mm.
But the details are truly mind-blowing.
Okay.
The thalidomide tragedy.
Right.
Imagine a drug marketed as a miracle cure for morning sickness, especially for pregnant women.
Right.
It was supposed to bring peace of mind, but what it brought was heartbreak.
Yeah. Thalidomide sadly had a horrific side effect that no one caught in time.
Right.
It caused severe birth defects in thousands of babies.
Yeah, it's hard to grasp the scale of suffering.
Yeah.
But out of this tragedy came a revolution in how we test medicines.
Exactly.
This wasn't just like tweaking a few rules.
Mm.
This was a complete overhaul.
Mm.
Suddenly, drug companies couldn't just say, trust us, it's safe.
Right.
They needed proof.
Right.
That's where rigorous clinical trials came in.
Right.
Testing on large groups of people before a drug ever hits the market, something we now take for granted.
Yeah, and it wasn't just about stricter testing. The idea of informed consent really took hold,
Yeah.
making sure that patients actually understand the potential risks before taking any medication.
Right.
So thalidomide kind of forced this shift
Yeah.
from blind faith to like informed decision-making in healthcare.
Talk about a lasting legacy, though, born out of immense suffering.
Yeah.
Now, from a drug tragedy, we shift to an environmental disaster that unfolded over decades
Right.
in a small fishing town in Japan, Minamata.
Minamata disease is a severe neurological disorder
Wow.
that emerged in the 1950s. And what's so chilling is how it was linked to industrial pollution,
Yeah.
specifically a substance called methylmercury.
Now, this stuff is nasty. Imagine a poison so potent that it can build up in fish and then cause severe damage to your brain and nervous system.
Yeah.
That's methylmercury. And it was being released into the water supply by the Chiso Corporation, a local chemical plant.
So basically the contamination spread through the food chain,
Right.
primarily through seafood, leading to widespread poisoning in the Minamata community.
Yeah.
And it wasn't like this sudden catastrophe, like an explosion or something. It was a very slow, silent killer that took years to fully reveal its devastating impact.
And this wasn't just a local issue.
Right.
Minamata became a symbol of industrial pollution's long-term consequences.
Yeah.
A stark reminder that what we dump into our environment can come back to haunt us in the most horrific ways. Japan responded with some of the strictest environmental laws in the world.
Yeah.
A legacy that continues to shape their approach to protecting nature today.
So Minamata forced a global conversation about corporate accountability and like the true costs of unchecked industrial growth. It's this reminder that sometimes progress comes at a terrible price.
Right.
And it's our job to ensure that future development happens sustainably and with respect for both human health and the environment.
From a slow-burning poison, we turn to a case where the consequences were delayed, almost hidden for decades. It involves a drug called DES, or dikelstilbestrol, initially prescribed to prevent miscarriages, but with tragic consequences that surfaced much later.
Yeah, DES is a heartbreaking example of how a drug's devastating side effects can take generations to fully understand. So it caused a high rate of vaginal cancer and reproductive problems, but not in the women who took it.
No.
The effects appeared in their daughters years later.
It's like a time bomb ticking away.
Right.
And what's even more unsettling is that France continued using DES long after many other countries had stopped.
Yeah.
This highlights the need for global communication in healthcare, especially when it comes to drug safety.
Right.
We can't afford to work in silos.
Yeah.
What happens in one country can impact people around the world.
The DES tragedy led to much greater emphasis on long-term monitoring of medications and the need for international collaboration to ensure that drug approval processes are consistent and prioritize patient safety above all else.
Right.
And it's just a sobering reminder that we're still learning about the long-term effects of many substances and practices, and vigilance is crucial.
From delayed consequences, we shift to a night of unimaginable horror in 1984, a date etched in history.
Yeah.
The Bhopal gas tragedy in India. This one event changed the landscape of industrial safety forever.
So a gas leak from a Union Carbide pesticide plant in Bhopal released toxic fumes. Not a small leak, mind you, but a massive one enveloping the city. Thousands died in the immediate aftermath, and countless others were left with chronic health issues, a legacy of suffering that continues to this day.
It's hard to grasp the sheer scale of this disaster, but Bhopal became a turning point. Suddenly, the world had to confront the question, what is the price of progress? Can we justify economic development if it means sacrificing the health and safety of entire communities?
Yeah, Bhopal was a wake-up call not just for India, but for the entire world. It exposed this critical need for stricter safety protocols, stronger regulations, and a new level of corporate accountability. It forced us to confront the potential consequences of unchecked industrial practices and to really rethink the balance between economic growth and the well-being of people and the planet.
And tragically, sometimes the institutions we trust the most can fail us, even in something as critical as healthcare. The contaminated blood scandals in both France and Japan in the 1980s are stark examples of this.
So imagine receiving a blood transfusion, a procedure meant to save your life, only to be infected with HIV or hepatitis C.
Wow.
That was a reality for many in both countries due to inadequate screening practices and a lack of oversight in blood banks. This wasn't just negligence. It was a betrayal of trust in the very systems designed to protect us.
The scandal sent shockwaves through both nations and beyond. People were rightfully outraged, demanding answers and accountability. It led to major legal battles and a complete overhaul of blood safety protocols.
It wasn't just about fixing technical errors. It was about restoring public trust in the healthcare system. These scandals highlighted the importance of transparency, rigorous safety standards, and this constant vigilance against complacency. They forced healthcare systems to confront their vulnerabilities and to prioritize patient safety above all else.
Shifting gears a bit, let's talk about food. Our next case revolves around ractopamine, a growth-promoting additive used in livestock feed. And it's a tale of two standards, different approaches to risk, and what's considered safe.
So the EU, China, and over 100 other countries have banned ractopamine, citing health concerns. Studies have linked it to adverse effects in both animals and humans. But here's where it gets interesting. In the U.S., it remains legal, which has led to trade tensions and sparked this debate about whose standards are right.
It's a reminder that what we consider safe in one part of the world might be viewed as a risk in another.
Exactly.
It makes you think, who are we listening to? What data are we using to make these decisions?
Right.
And ultimately, who gets to decide what ends up on our plates?
So the ractopamine debate highlights the challenges of establishing these global food safety standards. It's a very complex issue with both economic and political implications. And it underscores the need for greater international collaboration to ensure that what we're eating is safe regardless of where it comes from.
Now let's rewind to the 1970s and a controversy that ignited a global movement. The Nestle baby formula scandal. This one's not about a sudden disaster, but about a company's actions and the power of consumers to demand change.
This case raises a deeply ethical question. Should corporations aggressively market infant formula in developing countries where access to clean water and resources may be limited? So Nestle's marketing practices in the 70s led to accusations that they contributed to malnutrition and illness in infants.
People were outraged. This wasn't just a marketing mishap. This was a matter of life and death for babies. Think about the impact your choices can have. That boycott led to the WHO stepping in and creating a whole new set of rules to protect infants around the world.
So the Nestle boycott is a testament to the power of consumer activism and a reminder that we're not just passive consumers. We have a voice. Our choices can impact corporate behavior and even shape global policies for the better.
It's a reminder that sometimes the biggest changes start with everyday people saying, enough is enough. From baby formula, we move to a different kind of food scare. Mad cow disease,
Yeah.
a crisis that rocks the UK in the 1980s and 90s.
Right.
This one's not just about food safety.
Hmm.
It's about the terrifying consequences when a disease jumps from animals to humans.
Yeah. Mad cow disease or bovine spongiform encephalopathy. It was like a nightmare scenario.
Yeah.
Imagine a disease that attacks the brain, turning it spongy and then spreading through the food chain. The cause was traced back to this practice of feeding cattle with infected meat and bone meal,
Right.
essentially turning herbivores into cannibals.
And the human consequences were devastating.
Yeah.
People who consumed infected beef developed a variant of Creutzfeldt-Jakob disease, a fatal brain disorder.
Right.
It wasn't just a national crisis for the UK. It sent shockwaves through the global food system, making everyone question the safety of what they were eating.
So the UK had to cull millions of cattle.
Right.
And implement these strict new food safety regulations. And the EU banned British beef, highlighting just how interconnected our food chains are.
Right.
It was this wake-up call for the entire agricultural industry and led to a complete reevaluation of how we produce and consume food.
It makes you think about where your food comes from, how it's produced,
Right.
and the potential risks lurking in those complex supply chains.
Absolutely.
And speaking of controversial practices, our next stop takes us to Thailand and their ban on glyphosate, a widely used herbicide that sparked fierce debate worldwide.
So glyphosate, found in the popular weed killer Roundup, has been a subject of intense debate for years. Some studies have linked it to cancer and other health issues. Despite opposition from powerful agricultural companies, Thailand decided to put public health first and banned glyphosate outright.
It was a bold move.
Right.
And one that made a lot of people wonder, is this weed killer really that dangerous? Thailand's decision fueled the global conversation about the trade-offs between agricultural productivity and the potential risks to human health and the environment.
So Thailand joined a growing number of countries taking a stand against this controversial chemical, prompting further discussions about sustainable agriculture and the need for safer alternatives. It's a reminder that sometimes we have to make these tough choices, prioritizing long-term well-being over short-term gains.
It's a reminder that science isn't always black and white.
Right.
And sometimes we have to act on the best available information, even when there's uncertainty.
Yeah.
From pesticides, we turn our attention to a hidden danger that's been lurking in our homes and environments for decades. Lead. Australia's experience with lead's toxic legacy is a story of a slow awakening to a serious public health threat. One that took years to fully grasp.
So despite international evidence highlighting the dangers of lead, particularly for children's development, Australia was really slow to regulate its use in products like paint and gasoline. It wasn't intentional malice or anything, more like a collective blind spot, assuming that what had been used for generations must be safe.
It's a reminder that sometimes progress happens gradually. And it takes time for a scientific consensus to translate into policy action.
But in Australia's case, they eventually caught up, aligning with global recommendations and introducing stricter regulations.
That significantly reduced lead exposure.
And the results speak for themselves.
Exactly.
Blood lead levels in Australian children dropped dramatically, showing that even decades-old practices can be changed for the better.
It's a powerful lesson in the importance of learning from global experiences and taking action to protect vulnerable populations, even if it means challenging established norms and pushing for change.
It's also a testament to the power of science to identify risks and inform policy decisions that protect public health. Even if those decisions take time. We've covered a lot of ground today, from drug scandals and environmental disasters to corporate missteps and regulatory overhauls. But our journey isn't over yet. Stay tuned for part 2 of our deep dive, where we'll delve deeper into the lasting impact of these cautionary tales and explore the lessons they hold for a safer and healthier future.
Okay, sounds good. Welcome back to our deep dive into cautionary tales that have shaped the world.
Yeah, we've journeyed across continents, witnessing the devastating consequences of policy failures, corporate negligence, and those moments where humanity just didn't connect the dots in time. It's been heavy stuff, for sure, but we're not here to just dwell on the negatives.
Right.
Out of these tragedies and scandals, something powerful emerged. A drive to learn, adapt, and actually create positive change.
Precisely. Sometimes it takes a shock to the system.
Right.
A moment where we collectively realize, wow, we messed up.
Yeah.
To really spark innovation and reform.
Right.
So let's revisit some of those cases and see what good came out of them.
All right. Let's start with the thalidomide tragedy.
Okay.
Thousands of babies born with birth defects because of a drug meant to help their mothers.
Right.
It's hard to fathom.
But what emerged from that darkness?
You could argue that modern pharmaceutical regulation was born out of the ashes of thalidomide.
Yeah. Before that, drug testing was nowhere near as rigorous.
Right.
In Europe especially.
Yeah.
The thalidomide disaster led to mandatory clinical trials, testing on large groups of people.
Right.
To look for side effects before a drug is ever widely prescribed.
So from that heartbreak, we got a system designed to protect future generations.
Exactly.
And it wasn't just about stricter testing, right?
Right.
The whole idea of informed consent came into play, too.
Absolutely. Patients now have the right to know the potential risks before taking any medication.
Right.
It's a fundamental shift from doctor knows best to empowering patients to make informed decisions about their own health.
From assuming a drug is safe to demanding proof.
Exactly.
Thalidomide forced that change. Now let's move on to Minamata disease in Japan.
Okay.
That slow, silent poison that spread through the food chain. What lasting changes came out of that environmental catastrophe?
Minamata was a turning point
Yeah.
for Japan's approach to environmental protection. They implemented these comprehensive regulations to control industrial pollution, monitor water quality, and hold corporations accountable for the damage they cause.
So they went from being a cautionary tale to a model for environmental responsibility.
In many ways, yes. These measures significantly reduced industrial pollution in Japan
Right.
and set a high bar for environmental standards globally.
Right.
Other nations looked at what Japan did and said, we need to do that too.
It's a reminder that sometimes a country's biggest failures can lead to its most significant successes.
Yeah.
Now remember the Nestle baby formula scandal. This wasn't just a company making a bad decision.
Right.
This was a global movement ignited by outraged consumers.
People were furious.
Right.
And rightly so.
Yeah.
Nestle's aggressive marketing of infant formula in developing countries, sometimes at the expense of breastfeeding, led to boycotts, protests, and demands for change.
Yeah.
And this wasn't just a flash in the pan. This outcry led to lasting change.
So what came out of all that anger and activism?
The World Health Organization stepped in and created the International Code of Marketing of Breast Milk Substitutes.
Right.
It's a set of regulations to protect breastfeeding and ensure that infant formula is marketed ethically and responsibly.
So a corporate controversy sparked a global movement that ultimately led to better protections for infants worldwide.
Yeah.
Now let's talk about mad cow disease.
Okay.
That one really shook people's faith in the food system. What emerged from that crisis?
Mad cow disease forced us to confront some uncomfortable truths about how we raise and process livestock.
Right.
The practice of feeding cattle with infected meat and bone meal, which was the root cause, was banned outright.
It's kind of mind-blowing that it took a full-blown crisis to make that change.
Yeah.
But better late than never, I guess.
And it wasn't just about banning a single practice.
Right.
The entire food safety system, especially for meat production, was revamped.
Okay.
Stricter regulations, better testing, and enhanced surveillance systems were put in place to prevent a repeat of that disaster.
So a terrifying disease outbreak led to a global food safety revolution. Talk about silver linings.
Right.
Now remember, Thailand's decision to ban glyphosate, that controversial weed killer found in Roundup, that sparked a lot of debate.
Right.
But what positive outcomes emerged from that controversy?
Glyphosate became a symbol of this larger debate about pesticides.
Right.
Our reliance on chemicals and the potential risks to human health and the environment.
Right.
Thailand's ban, while controversial, forced a global conversation that's still going on today.
It made people think twice about what they're spraying on their lawns, what's ending up in their food, and whether there are safer, more sustainable ways to farm.
Exactly. The controversy surrounding glyphosate has spurred research into organic farming methods, biopesticides, and alternatives that don't rely on potentially harmful chemicals.
Right.
It's also fueled consumer demand for food that's produced with fewer synthetic ingredients.
So, Even though the debate about glyphosate's safety continues,
Right.
it's pushed us towards a more sustainable and health-conscious approach to agriculture.
Exactly.
And that's a win for everyone.
Right.
Finally, let's revisit Australia's slow realization of the dangers of lead.
Okay.
What positive changes came out of that delayed awakening?
Australia's decision to phase out lead from paint, gasoline, and other products was a game changer for public health, especially for children who are most vulnerable to lead poisoning.
It took them a while to catch up with the rest of the world.
Yeah.
But once they did, they went all in.
And the results were undeniable.
Right.
Blood lead levels in Australian children plummeted, proving that taking action, even decades after a problem is identified, can have a profound impact on public health.
It's a reminder that progress is possible, even if it's slow and sometimes messy.
These examples show us that we have this remarkable capacity to learn from our mistakes, adapt to new challenges, and create positive change. It's not always easy, and it often takes a crisis to spur action.
Right.
But these stories offer a glimmer of hope for a future where we prioritize health, safety, and sustainability above all else.
It's about learning from the past to create a better future. One where we're more aware of the consequences of our actions and more proactive in protecting ourselves and the planet. Welcome back to the Deep Dive.
We've been on quite a roller coaster ride through history, exploring those oh no moments where things went terribly wrong, from drug disasters to environmental calamities.
Yeah.
It's been a lot to process.
But amidst all the cautionary tales, we've also uncovered a spirit of resilience, a drive to learn from mistakes and create a safer, healthier world. But this isn't just about big institutions or governments.
Right.
It's about each of us, too.
Exactly. So in this final part, let's shift the focus to you, the listener.
Okay.
How can we take these lessons and apply them to our everyday lives? What are the big picture takeaways that should stick with us long after this deep dive is over?
Well, first and foremost, I think these cases highlight the importance of critical thinking.
Yeah.
We live in this age of information overload, bombarded with messages from every direction.
Right.
Don't just passively absorb it all. Question your sources, consider biases, and seek out diverse perspectives.
It's like becoming your own BS detector.
Exactly.
And it's not about being cynical. It's about being informed and discerning.
Right.
Especially when it comes to decisions that impact your health, your finances, or even the products you choose to buy.
Absolutely.
Right.
And speaking of products, these stories remind us that there's a whole world behind that item on the shelf.
Yeah. Where did the materials come from? How was it made? What are the ethical and environmental implications of your purchase?
It's easy to forget that we're not just consumers.
Right.
We're voters with wallets.
Exactly.
Our choices have power.
Yeah.
They send signals to companies about what we value, what we're willing to support.
Precisely. And don't underestimate the power of collective action.
Right.
The Nestle boycott is like a prime example of how everyday people, when they unite around a cause, can hold powerful corporations accountable and drive meaningful change.
It's inspiring to see what can happen when people say, we're not okay with this.
Yeah.
You might feel like a drop in the bucket, but those drops add up to a wave of change.
And change doesn't happen overnight.
Right.
These cases show us that progress can be slow, messy, full of setbacks.
Right.
But the key is to stay engaged, keep learning, keep pushing for a better future.
It's easy to get discouraged
when
you see the scale of the challenges we face.
Yeah.
But these stories also offer hope. They show that humans are capable of incredible things, both good and bad.
Right.
It's up to us to choose which path we want to follow.
So as you go about your day, think about those seemingly small choices you make. What you buy, who you support, the information you choose to believe. Those choices add up. They ripple outwards, impacting not just your life, but the world around you.
We've covered a lot of ground today, from the darkest chapters of human history to those glimmers of hope that show us a better way forward.
Yeah.
But this deep dive doesn't end here.
These are just 10 stories out of countless others. It's up to each of us to keep learning, keep questioning, keep pushing for a world where these cautionary tales become lessons learned, not tragedies repeated.
What resonated most with you today? Which cases made you think differently about the world around you? We'd love to hear your thoughts.
Remember, Every deep dive is a chance to learn, grow, and make informed choices for a better future.
Thanks for diving deep with us.